Hello everybody and welcome back to Daytime with Kimberly and Esteban. I'm Carla Salinas and today we are talking to Dr. Torres at JNC Behavioral Services all about depression and anxiety. Doctor, thank you so much for meeting with us today.
Thank you, Carla, for having me on your show.
Of course. So tell us a little bit about depression. I mean, what causes it?
Depression is an emotional state where people feel very low on their moods.
JNC Behavioral Services has an integrative approach to their treatments, and the doctors believe changes in diet, exercise, meditation, and yoga can come a long way in helping improve a patient's mental health. And although some of us can get a little sad sometimes, Dr. Torres explains someone who's experiencing depression needs professional help.
And the difference between feeling sad and feeling depressed is that depression is a more long-standing and pervasive sense of low mood. It doesn't get better with changes on the environment, and it's something that is so persistent and impairing that it impacts on different aspects of the person's life.
Dr. Torres explains his goal is to help patients overcome their depression and eventually not need medication.
We try to teach the importance of having an early diagnosis, and that's very key in the treatment because depression, if it's not well treated or not treated at all, it can become very chronic, and that's one thing that we're trying to avoid. So by educating and trying to identify with an early diagnosis, we could use less aggressive treatment interventions, and we try to avoid having to start them on an antidepressant right off the bat. There's also many reasons for which people can get depressed, such as side effects from medical medications that they're already taking, medical conditions that they have not been diagnosed with. And that's one of the things that we do at JNC. We evaluate the patients, we do a comprehensive assessment, and we do request blood work to determine if there's any organic causes that would trigger that level of depression. It can be things like low levels of certain vitamins, it can be anemia, it can be some problems with their pancreas, with their liver. Even sometimes abnormality on their heart rhythm could cause a certain degree of anxiety or depression. And we need to identify those because that might not require a psychiatric medication and actually might need medical treatment. So that's one of the main things that we try to emphasize on.
For more information, call JNC Behavioral Services at 956-600-7807 or visit their website at drtorres.com.